The purpose for derotation is to position the coffin bone in its normal weight-bearing relationship with the ground. With chronic rotation due to laminitis, without the mechanical advantage of the gooseneck to support the front of the foot, it's absolutely impossible to derotate and secure a shoe to the foot. Derotation is vital to the success of a tenotomy. I found in my experience after several hundred tenotomies that the coffin bone must be placed mechanically in a position where it can bear weight in as normal fashion as possible prior to cutting the tendon, immediately prior to cutting the tendon. Those tenotomies that are done without derotation have little success. The relief to the patient is very short-lived. Tenotomies have been a very effective way for me to treat life-threatening disease processes due to laminitis. It's a very quick procedure. It has very little risk. If done in opportune time with proper derotation, it's proven to be a very successful treatment, even though it's still considered a salvage procedure. Trimming the foot before shoeing is quite important. If you have chronic rotation of 10 degrees or more, a lot of heel must come off, but the heel has to be trimmed from just slightly behind the apex to the heel. A very common problem that I see with a lot of my colleague farrier friends is they want to lower the heel starting at the toe of the foot. By doing this, you thin the sole very, very thin. When the shoe is applied, the horse becomes lame only because you have removed all the natural protection there is between the apex and the ground. To lower the heel on a rotated horse, start behind the apex of the frog, as shown here, and trim from there back. Once the frog has been trimmed to its normal position, it's quite easy to see how much heel wants to come off even without a radiograph. If you are left to trim a foot without a radiograph, you merely have to trim the frog, as shown here, sight down the frog, lower the heel so that the plane of the bearing surface of the wall is in the same plane at the same level as the frog. Radiographically, this will be in true alignment with the coffin bone. Yes, it's always good to have a radiograph prior to trimming a laminitic foot, but it's not necessary in all cases at all. Once you have developed an eye for sighting down the frog, such as I described, you can become very comfortable in always knowing exactly where the coffin bone is in relationship to the wall by merely sighting down the frog. This is the plane that the shoe must sit on. Well, it's quite obvious when you do this. There's a large gap forms between the toe of the foot and the shoe. Many times you can only get one heel nail in the shoe, and it's about 2 inches behind where you would normally like to put the last nail. So you make a shoe that accommodates this new positioning. The wall is very thin, it's very straight, it's quite easy to prick this animal in this part of the foot. You can put 3 nails over an area of 1 inch, remembering you only need 1 good nail. The gooseneck then is applied to the front of the shoe as a mechanical prop. The gooseneck actually can replace the advantage of 10 good nails. I use the gooseneck with white line disease, laminitis, club feet, feet who have been surgically or mechanically destroyed due to injury, as a means to hold a therapeutic device on the foot during the healing phase. It replaces nails. This gooseneck is applied with the band, much as I use with patching toe cracks. It must meet the contour of the foot. I drill 3/16 inch holes. I shape it to the foot. I hot seat it to the foot so I have a nice perfect fit. You attach a band using 10 gauge metal. It's nothing, we refer to that as a tail. It's welded on top and bottom, as you will note here, not on the sides. If you weld it along the sides, the weld will straighten your band. You weld it top and bottom only. That's sufficient to hold the weight of the horse. The shoe is held underneath in a proper position. If necessary, put 2 nails in to hold it in place. Do not set the foot down. If the foot is set down while the nails are in place, you merely rock forward and pull the nails out. So you place the 2 nails in, pull the foot forward, lay the gooseneck on the foot in the position it's been burnt in, mark the tail of the gooseneck in such a fashion that you know exactly and precisely where it fits on the shoe. Mark the shoe, mark the tail, go to your vise, turn the shoe upside down, hold your band with a very heavy glove and spot it in place. Remembering there are several planes that you are now dealing with: the vertical plane, the medial-lateral plane, and also the horizontal plane. It's quite easy to overlook any one of these planes or all of them. A little experience is always necessary to put a few of these on. Use 10-gauge metal or slightly lighter because you want to be able to mechanically reshape this gooseneck after it's applied to the foot. A common mistake is to make it too long. You do not want it up in the corner of your band. You want it to fit approximately 1/4 inch from the top of the corner of your band. This allows you to put number 8 1/2-inch panhead screws into the horn wall. Remember, when you screw these in, the shoe is nailed on first with 2 nails only. Bring the foot forward. Have your assistant to sit down in front. I prefer to use a Dremel tool with a cut-off nail as a starter instrument. Do not put, once again, do not put a drill bit in your Dremel to start your holes. A good sharp drill bit, unless it is adjusted with a stop, will end up in the coffin bone invariably every single time, because it will suck that bit in so quickly that you can't stop it. I've seen this mistake many, many times. I have been guilty myself. Once again, remember, do not use a drill bit as a starter bit. Cut off a nail. A copper nail works very nice. All you want is a little starter hole. Then you can slowly put the screw in, pushing firm and turning slow. You can tighten the band down very tightly. Once all the screws are in the band, then the foot can be set down. If you inadvertently set the foot down prior to attaching the band, most likely you will have to reposition the shoe, retighten your heel nails, and start all over. Now you have mechanically derotated this foot. Surgery must be performed immediately, or if the horse has to now be transported to the veterinary hospital, for some reason the veterinarian cannot do the surgery at that time, you must now apply 2 to 3 wedges, approximately 17 degrees, beneath the shoe in order to reduce the pull on the deep flexor tendon which you have now created by derotating. This is very important.